This is the tale of two communities and one man's journey. Our character Fred experiences two different lives, one living in Community A and one living in Community B. Fred's life in Community A turns out quite differently than his life in Community B. What makes the difference? Let's find out. Let's take a look at Fred grew up in Community A. Meet Fred. Fred grew up in a small community called A. Fred's mother struggled with her pregnancy. She had little family support and there was no prenatal services or breastfeeding support in her community. Fred's mom was connected with services in a different community, but she struggled to attend as frequently as she wanted due to transportation issues. When Fred was older, he started daycare so his mom could return to work. Meal times were stressful and unpleasant. The staff usually made him finish his whole plate, even if he was full or he didn't like the food offered. He would cry and scream, especially when oatmeal was served. He hated oatmeal, and this constant battle made mealtimes no fun for Fred or for anyone. This feeding practice led Fred to dislike oatmeal into his adult life and to feel the need to always finish his plate, even when he was full. In middle school, Fred doesn't like recess. The kids just stand around and play on their phones. Fred wishes there was a fun activity they could all do together. He had some in mind, but was too shy to suggest anything to anyone. Fred does really like lunchtime, though. The cafeteria serves chili and hot dogs, or fries and pizza. Fred knows his mom doesn't like him eating these foods every day and had talked to the school staff about it, but she was having a hard time convincing them. They said they would be open to trying a menu change, but they were not sure if the kids would like it or how to do it while staying on budget. So without much support or interest from the school community or access to a school nutritionist, the change never happened, and Fred continued to eat these foods every school day and grew up thinking this was okay. In high school, Fred is bullied for his weight. His health teacher weighs them every month to see if making them track their calorie intake and running 10 laps every day has made them lose weight. Some of the kids are getting really stressed out about it and have developed a poor body image and low self-esteem. The other students noticed that Fred's weight was a little more than theirs and called him Fatty Fred. Fred saw a public health nurse who told him he was healthy and following appropriately along his growth curve, growing into the body that is right for him. But his new nickname really hurts. He's not sure how he can handle all this teasing and anxiety it is causing him. Feelings and emotions aren't something that he has ever really talked about with anyone. Now that Fred is attending university, he would love to bike to school, but it is hard and dangerous to do along the route he has to take. He has a lot of homework at night, so that bike ride would be the only physical activity he really gets in a day. There's no bike lanes, and the cars drive really fast. He saw another student almost get hit once. As a result, Fred drives to school every day, which he knows isn't good for his health or the environment. He also doesn't get an opportunity to see and chat with the people in his community when he's sitting in a car. Fred marries and has a son. Fred's not sure how his son ended up with so many cavities and a rotten tooth. It's really painful for his son to eat, but Fred does not have a dental plan at work and isn't sure he can afford to get them fixed. On top of this, Fred's mom gets diagnosed with diabetes. She's in and out of the hospital and is unsure how to manage her disease. Fred doesn't know how to help her either and just hopes things don't get worse. As an older adult, Fred has trouble moving. He never really learned different ways to move his body. He has a heart condition and has been feeling lonely lately. His doctor thinks he should try taking new medication, which would mean 10 pills a day. There isn't anything offered in his community for older adults, and it would be hard to walk to the community center anyway. The snow never gets cleared. Now, let's take a look at Fred's life in Community B. See if you can spot the differences. This is Fred. He was born as a healthy baby boy on June 23rd in Community B. As Fred grew up, his family always ate dinner together and rarely had any fights or felt stressed out around mealtimes. Fred's mom had received information, practical tips and support for eating well with children at one of the family centers and at Fred's daycare. One of RQHR's public health nutritionists, named Helen Flangeris, had provided education and training sessions for the clients and staff at each of these centers on Ellen Satter's The Division of Responsibility in Feeding. Before this, Fred's mom thought healthy eating was only about what types of food to eat, but she learned that the practices around how we feed children and how we eat are important too. Fred's mom learned about the feeding relationship, that the parent is responsible for what, when, and where children eat, and the child is responsible for how much and even whether to eat from what parents provide. The results from following these practices included peaceful mealtimes without any kicking or screaming, and Fred growing up as a healthy and competent eater. Next, we see Fred at daycare. His daycare is involved in a program called Friends. The kids love it. They are learning about coping techniques, positive thinking, and how to express their feelings doing fun activities and games. Fred will learn the skills he needs to cope with stressful situations as he grows up and faces life challenges. As Fred enters elementary school, he sees his mother pack him the best nutritious lunch. A peanut butter and banana sandwich on whole wheat bread with grapes, carrot sticks, and yogurt on the side. Delicious. It didn't always used to be this way. Fred's family lives in an area where there used to be no fresh produce available, and Fred's mom didn't always have access to a vehicle to get groceries. But since the community store joined the RQHR Real Food Program, developed by public health nutritionists Tracy Sandin and Kaylee Michnick, there has been fresh produce offered just down the street, easy to access. In grade 6, Fred's class became involved in a program led by students and teachers called Take the Lead. The leaders received training to administer the program through the Health Promotion Department's health educator, Roland Holness, and Saskatchewan Parks and Recreation Association. Once a shy kid, the teachers have noticed that Fred is taking on a leadership role very well. He and his peers now take turns leading younger classes in fun games and activities that get them up, moving and laughing together, and staying out of trouble at recess, lunch, and after school. The Health Promotion Dental Team, consisting of Crystal Bjornson, Rosemary Henriksen, Leslie Marlin, Brooke Langman, Lenia Rivera, Vicky Trammer, Megan Forsyth, Kelly Fuchs, and Patricia Saplicki also came to Fred's school that same year. They checked Fred's teeth and gave him fluoride varnish and protective sealants on his chewing molars. They showed him the proper way to floss and sent him home with a new toothbrush, floss, and toothpaste. No cavities for this little guy. But a few of his classmates had some dental problems. These children were recommended to see a dentist. As Fred prepares to enter high school, he's scared about being bullied. He's a little overweight and he wonders what the students will say. But once he starts school, everything turns out okay. The teachers and nursing students working in the school have worked with Chelsea Brown, a public health nutritionist from the Health Promotion Department, to better understand how to promote a positive body image and that weight is not the best measure of health and not appropriate to ask students to do in school. Fred goes to university. It is a stressful time, but he has built on the skills that he learned from taking the Friends program many years ago and knows how to handle the stress. Fred keeps up his fitness by biking to and from university. It is a really easy and fast bike on the bike lanes in his community. It's an enjoyable ride, and he sees others in his community outside, walking in the parks, participating in the community garden, and relaxing on the benches. Even the RQHR Health Promotion Building in the community has an urban garden. A project started by public health nutritionist Kaylee Michnick called Create a Space that models and outlines how other businesses and organizations can do the same. At night, the community is well lit. He often sees the older adults from the senior center he volunteers at walking in the community as part of a walking club. Even those who have trouble walking do fine as the sidewalks are wide level, and easy to push a walker on. In the winter, the snow and bike lanes are cleared as well, so people can continue using them. Our neighborhood design can either make it harder or easier for people to make healthy choices. Clearly, when this community was planned, health was taken into consideration. The Health Promotion Department's health educator and active living coordinator Peggy Cherney and Joy Slusser helped to make lots of these good recommendations to city planners and developers, recognizing the impact the design and structure of our communities has on the residents' health outcomes. A few years later, Fred starts his own family. Fred's son starts kindergarten and comes home one day with a fresh garden carrot. It looks like Health Promotion's public health nutritionist Chelsea Brown, along with community partners, has helped to start organize an event called the Big Crunch at Fred Jr.'s school. This event helped them learn about healthy eating, where our food comes from, and help support our local food producers. Fred Jr. also tells Fred that instead of selling cupcakes and ice cream coupons, the school is now doing a local fundraiser through Farm to School Saskatchewan. Fred's teachers and the school nutrition coordinators have worked with Chelsea to make healthy eating fun and appealing for the students. During this time, Fred's mom is diagnosed with diabetes. She really isn't sure how to manage her condition and needs more support. Fred had heard about a free program offered by the Regina Qu'Appelle Health Region Health Promotion Department for anyone with a chronic health condition from the coordinator, Sarah Snyder. Live Well with Chronic Conditions and Live Well with Chronic Pain are peer-led, self-management workshops facilitated by pairs of trained volunteers or healthcare professionals, one or both of whom may have a chronic condition themselves. In the workshop, Fred's mom learned to manage symptoms and medication, relax, handle difficult emotions, eat well, and exercise safely in a very supportive environment. Fred's mom finished the interactive 6-week program and now feels more confident to manage her diabetes and plans to use the tools she learned in the workshop. Fred is now an older man. He doesn't have as many friends as he used to in his community. He saw at the community center that they are partnering with Health Promotion to offer a program called Forever in Motion, led by Marisol Molina-Smith. After a month of going to the free, volunteer-led class, Fred feels great. He feels stronger and is not as worried about falling. He's also getting out of the house more and has made good friends. These same programs and initiatives Fred has been involved with in the city are also offered in rural areas by the health promotion team out there, Fred Lowenberger now being one of them, as well as Teresa Fayant, Karen Holloway, and Larry Tittle. And the whole health promotion team is managed by the fabulous Peggy Cherney. You can find us on Facebook and Pinterest, or contact Jamie Chickovin, the wonderful confidential administrative assistant.